So your skin's gone really red and itchy and you don't know if it's food allergy, is it eczema or anything else. I'm Zainab, I'm the pharmacist from PillSorted, and I'll explain what a contact dermatitis is, what is an allergic dermatitis or eczema, and how we can treat both of them. The important difference between these two is that the allergic eczema or the atopic dermatitis, as we call it, runs in our genes. That means you can't cure it completely and it will flare up. As we discussed in previous videos, it is a lot related to genes. If one of the parents has got hay fever or other forms of allergy, this can show as eczema in the child. Usually it shows itself with dry and flayed skin in the creases, so in the elbows, at the back of your knees, and it is because the skin doesn't produce enough moisturizer. So there's cracks between the skin that'll let the moisture out and let the irritants in. That's allergic eczema or atopic dermatitis. Now, the other one is contact dermatitis. So the most common contact dermatitis is actually when your skin gets directly exposed to something really harsh. So it's usually the hands, and anything that's too harsh like bleaches or detergents, soaps, these can cause the skin to dry out, especially the ones that have got a high content of alcohol. The other one is called the allergic contact dermatitis. So some substances, when your skin gets exposed to it, it'll come up with rashes. So for example, metals like copper and nickel can bring a lot of allergy. So nickel is the buttons on the jeans usually. Some jewelry have got nickels in them. Other things are like fragrances. So some fragrances, some cosmetics, and some hair dye, these can cause allergic dermatitis as well. As I said, the key difference between these two types is if you realize what's causing the dermatitis problem, the allergic problem with the contact ones, and you avoid them, you won't have to encounter it anymore. But with eczema, it will carry on being there, so you just need to be able to manage it all the time. The other kind of skin flare-ups can be caused by other stuff like pet allergies. This is something that I hear a lot, that I've got cat hair allergy or I've got dog hair allergy. It's not actually the hair or the fur that is causing the allergy. It's the tiny particles that they produce in their skin which causes the allergy. These tiny particles in the pet skin or in their saliva gets airborne, and it can stay in the air and on the furniture, on your clothes for a very long time actually. Another thing that I want to talk about is that there's no truly hypoallergenic dog or cat. So poodles, labradoodles, all of these have got allergens in their skin and their saliva. They're not completely allergy free. The symptoms of pet allergy are runny nose, hay fever type symptoms. It can come up as flares up of the skin or even running out of breath a little bit. How do we manage pet allergies? The important thing is keep your bedrooms pet free, okay, so that when you want to sleep and rest, these allergy symptoms don't show up. Wash the pet bedding with hot water. Vacuum everywhere with HEPA filters, okay, so that'll take the allergies out of the air. And there will be antihistamines if you feel that it is ongoing and it's not getting better. If you guess that you have a sort of allergy, you can always ask for a skin prick test to make sure that you do have an allergy or not. One of the other types of skin allergies is the dust mite allergy. So dust mites are these tiny microscopic beings that live everywhere around the house. They can live in especially in the beddings, but soft furniture, soft toys, and what they do is they live off the dead skin that we shed. Their droppings causes allergy. It is quite common, so 1 in 5 adults usually test positive for dust mite allergy. In children who've got eczema, almost all of them test positive for dust mite allergy as well. So it's really important to try to keep the house, or do these preventative things to keep the house as least exposed to dust mite as possible. What are the symptoms? Again, blocked or runny nose is one of the most important symptoms that you see. Itchy eyes, worsening of your eczema, and coughing and wheezing as well. What are the things that you can do? Allergen proof covers for your mattress, for your pillows, for your duvet. These are really important. Another one that's really useful useful is washing all of your mattresses and pillows with over 60 degrees, because dust mite can't live in that temperature. The other thing is dust mite really like humidity as well, so don't keep your rooms too humid, and then they won't be able to survive. And the other thing is, when you want to dust the surfaces, use a damp dust, because if you just use a dry cloth, you're just making all of the allergens stir up. But if you use a damp one, you can actually clean up and take them away. The truth is, you can't ever eliminate completely the dust mites, but the goal is to have it as minimum as possible, especially during bedtime, when they can make your eczema worse, or you can make all of the allergies worse. So are there any food allergies that can affect the skin? Yes, there is, and there's a couple of them. Some of them cause really fast onset allergies, so you'll see swelling and tingling in the lips, tingling on your tongue, itchy eyes. So these will come up really fast, and good couple of foods can cause this, like cow's milk, like eggs, like fish, peanuts. There's a delayed one as well, so it will cause itchiness and flare-ups on the skin. Sometimes that one's harder to understand, but it's really not as dangerous as the first set of the fast allergic reactions that come with the food. Okay, now another important one that I want to touch base is food allergy is very different from food intolerance. So there's a lot of food intolerances, for example, to milk, and what that does, it causes digestive issues like bloating, like being a little bit windy, or diarrhea. But true allergies show themselves all over your body and shows with skin reactions like swelling and breathing problems. If you're not sure about either of these, reach out to us and to your healthcare professionals, and we'll help you understand if it's an actual food allergy or is it the food intolerance. How do we protect our skin? The one and most important thing is try to prevent. It's always better than curing. Okay, so for prevention, a couple of important things. If you're going out and about and you're worried about having your skin exposed and getting itchy, you can wear long sleeves, long trousers, and that'll help protect your skin. The other one is sun cream. So sun cream is not just about preventing you from burning in the sun. It's actually a good protective layer, especially the ones that have got elements like zinc and titanium, because they will help like a barrier on top of your skin, and it will help protect it from getting any exposures. And the other one is try to use hypoallergenic, fragrance-free soaps, creams, so that they don't flare up, and use as much as you can emollients, lubricants for your skin to make sure that it's constantly moist all the time. Emollients, there's a lot of different ones in the pharmacy. A couple of examples: Diprobase, Double Base, Epiderm, Citraben. All of these are really good examples of emollients. Use them as much as you can and as liberally as you can, so that it protects all of your skin. If you feel a flare-up is coming up, you can use a steroid cream. There are lots of different options available in the pharmacy, and you can use it up to 2 weeks. That would usually help clear up any of the episodes. However, if after 2 weeks you see it's not getting better, or if there's any oozing or yellow crust around, it might be that there's a secondary infection. So again, get it checked, and there are options available that make it better. Antihistamines, as always, are good. Both tablet wise are the best ones. If not, some antihistamines are much more effective towards skin allergies, like chlorphenamine, the Piriton. It does cause a little bit of drowsiness, but it's actually quite good for skin allergies. What do you need to look out for? If you see there's hives and rashes that are spreading out really fast, if you feel there's swelling on your lips or itchiness or running out of breath, these are important ones that you need to reach out to the emergency services, 999, 111, and you might need the adrenaline injection, you might need steroid injections. Again, if your skin is not clearing up, swellings are not clearing up after 2 weeks of using steroids, they're becoming oozy, they're bleeding, those are the times that you need to see the doctors as well. As a recap, skin allergies are common. Most of them are easily manageable. They need proper daily routines and protections, but some of them can be serious. This video is part of our allergy and hay fever series. If you've got any questions, feel free to reach out to us for that safe clinician-led advice. Thank you.